I'm Rip Esselstyn, and you're listening to the Plant Strong podcast. What happens when a seasoned cardiologist realizes that prescriptions and procedures just aren't doing the trick? Well, you get Dr. Jami Dulaney, a board-certified cardiologist who transformed her practice and her personal life, by the way, by embracing plant-based nutrition and lifestyle medicine. I'm going to have her story right after this message from Plant Strong. What if one day could change your mindset and 1 week could change your life? Well, we've got both coming your way. First up, don't miss Plant Stock 2025. It'll be streaming live on Saturday, September 6th. This virtual event is your front row seat to the future of food as medicine, with powerful presentations from rockstar doctors, experts, and real people who have transformed their health with the power of plants. Tickets are just $29, and partial proceeds support the rebuild of Blue Ridge Assembly, our beloved second home in Black Mountain, North Carolina. Then, in November, join us in person for the Plant Strong Retreat in Black Mountain. It's 6 days of total transformation filled with nourishing food, movement, connection, and the latest and greatest in lifestyle medicine and nutrition science. Healthcare providers, this one is for you. We are offering continuing education credits as part of your registration. So whether you want to join us online, in the mountains, or both, this is your chance to reset, reconnect, and reclaim your health. Grab your spot now at liveplantstrong.com and then click on events. I appreciate doctors, and I know that you do as well, who aren't afraid to challenge the status quo, because I think that we all know it's incredibly hard to do this, almost impossible. But cardiologist, Dr. Jami Dulaney, she's one of those rare physicians who found herself working in a broken healthcare system and decided to do something about it. As she says on her website, visiting a cardiologist is not just about getting a stress test or medication for chest pain or elevated cholesterol. That's antiquated medicine, and it clearly hasn't worked. Instead, Dr. Dulaney has flipped the script on her practice. She wants to understand her patient's background, their health history, and how they currently live, not to place blame, but in order to better educate and empower them on how to cure themselves, primarily utilizing a whole food, plant-strong diet. Today, Dr. Dulaney shares how she came to this realization and then pivoted her practice, and even how she incorporates it into her own life as a triathlete and ultra-distance trail runner. Let's meet this heart doctor with a big heart for food as medicine, Dr. Jami Dulaney. Dr. Jami Dulaney, I want to welcome you to the Plant Strong podcast. It's great to see you and be with you today. Before we get rolling here, I'd love for you to tell me, is Jami your real name, nickname, birth name? What's with the name?
Jami is my nickname. My real name is Jamila, half a James, half a Pamela. And because no one can really pull that off, I go by Jami.
Jamila. Wow.
Yeah,
Wow.
That's it. You know, most of the time people swallow their tongue on that one. So,
Wow. Now, is that something that your mom and dad kind of dreamed up?
my mother did. My dad was James, and a really good friend of the family was Pamela, and they liked that name. And so she hooked them together.
I love it.
Turns out the funny part about it, turns out it's actually a Arabic name as well. It's very common. Of course, there's just some other different handles on it and, of course, pronunciation. So I've had a lot of twists on it over the years. Yeah. But, actually supposedly means beautiful in Arabic. So I got lucky.
Nice. Well, I really look forward to this conversation today. You know, in doing my research on you, I really love your spirit, and I want everybody that's listening today to get a taste of your spirit and what drives Dr. Jami Dulaney forward. So why don't, again, before we really get rolling, where am I talking you to? I know you're in Florida somewhere, but where in Florida?
I am in a little town called Port Charlotte, which is about an hour and a half south of Tampa on the West Coast. If you watch the Weather Channel, we were the direct hit of Ian a couple years ago. So that puts us on the map during hurricane season, unfortunately.
Yeah. Well, and so you weren't born and raised though in Florida. You were like Pennsylvania, West Virginia gal, right?
I am a mountaineer born in Morgantown, West Virginia. Yes, I moved here in 1999. So it's coming on. I'm getting a good bit of time stored up in Florida now. But yes, I was born and raised in West Virginia, went to medical school there, crossed over the border to do my residency and fellowship at the University of Pittsburgh, then
Yeah.
came back to West Virginia, and then made the trip south.
And what was it that took you to Florida?
My parents were snowbirds, and I was a golfer at the time. So after shoveling snow in West Virginia and my dad telling me about all the, nice weather they were having, it's like I've had enough. I decided to get out of academic medicine. I was going to go into private practice, so I thought I would come to Florida and be a private cardiologist in golf, and I never did once I got here.
No, I guess not. How many years did you golf for?
I was an avid. I mean, our whole family was golfers, so vacations were around there. So I golfed through college. Med school had obviously dropped off substantially, but I grew up as a golfer, which is funny. Now I'm a runner, and so the two are not that connected. So, but yeah, my walking was all on the golf course early on.
Well, maybe all the running you're doing is penance for the golf.
Probably it is. Probably it is. One of the things is, when I moved to Florida, and I saw, unfortunately, the golf is not doesn't lend itself to that healthy of a lifestyle. And that's part of it that became a detraction. And I had a young daughter, and so I would take her to swimming practice, and I would swim, or then I'd take her to, whatever, to soccer, and I started running. And that's kind of when I caught the running bug, because it was a lot easier to get miles in with a young child running than it was to do anything else. And that's kind of how all that got started.
Well, explain to me. So you say that potentially golf doesn't lend itself to a healthy lifestyle. In what way? Because to me, you're kind of outdoors. You're getting sun, maybe too much sun. But what is it? Is it the drinking? Is it the steaks at the club? What is it?
Yes, yes. It tends to be the people that, amateur golfers, not professional golfers. It's kind of a whole different thing. But a lot of amateur golfers, it becomes a way to relax, put a 6-pack of beer on the course, eat hot dogs and hamburgers and steaks and walk. When I was in West Virginia and I grew up golfing, I actually walked and carried my bag. When you move to Florida, everybody's riding a golf cart. So, I mean, that took that aspect out of it. And so it just wasn't, it was a time consuming sport that didn't give me the exercise that I wanted, basically.
Yeah.
That's a better way to put it.
Yeah. So you're all about being healthy naturally, and you've got a really interesting practice and kind of niche that you've carved out for yourself there in Florida. I'd love for you to tell the Plant Strong listeners, a little bit about your practice and the different aspects that you cover in your practice.
Well, I'd like to first give a big thanks to your dad, because if it hadn't been for listening to how your dad went about his study with the first 25 people and then the 100 people, and what he said resonated with me was that if you teach somebody how to cook and you explain to them the why, they're more likely to do it. And I grew up in a family of teachers, and they always, if you don't teach somebody if somebody doesn't learn, it's because you're not teaching them the right way. So that was my attitude from the beginning. And once I decided my traditional cardiology practice, of course, I ran, I'd exercise, I put my marathon posters on the wall. Nobody ever ran a marathon because of it. But I was hoping to, encourage people to exercise. And of quite frankly, early on, I give them the book, Dean Ornish's book, and say, read this. If you can do it, good luck to you. And then I went vegan myself, and because of cardiovascular, a terrible family history, one thing led to another. And I wanted to try to figure out how to incorporate the nutrition into the practice. And when I heard of your dad's study, I was like, that's what I want to do. I'm going to teach a nutrition class in the office, and we're going to get people to be plant-based that way. So I told my mom, I said, I'm going to teach an evening class. I'm going to coerce some patients into taking the class. I made them pay $25 each to make sure they'd show up for a 16-week class. And I'm going to talk to them and cook in front of them so they learn how to eat plant-based. And she said, you're going to fall on your face. You can't talk and cook at the same time. And it's like, I'm going to try. So we started with 16 people in the back room, 16 chairs, a whiteboard, and didn't take very long till people were starting. I was taking blood pressure pills away from people. I was reducing their statins. Diabetics were telling me they no longer had diabetic peripheral neuropathy. And it's like, wait a minute, this is actually working. For the first time in my entire cardiology practice, I'm actually taking medicines away from people.
So when did you start this, and how long had you been practicing cardiology before you kind of started initiating some of these protocols?
I came to Florida in 1999 to enter private practice, 1998 to enter private practice. And in 2013, 14 is when we started doing the nutrition classes. So it took a while. I was vegan probably since 2000, 1999, 2000, that area is where I became vegan. Initially not, entirely Dr. Esselstyn vegan type of thing, more of a vegan all around, not junk food for the most part, but I hadn't given up oil early on, until we kind of did that next loop into things. I kind of considered myself healthy and could get away with, I had Rip Esselstyn's book. So I kind of dabbled both ways a little bit. But when I, again, heard Forks Over Knives, your dad and mom's cookbook, we started by teaching that cookbook essentially, and those kind of recipes, 20 in that first nutrition class of 16 people.
Yeah. And both if I'm remembering correctly, it was both your mother's parents, so your grandparents, that died early, like in their 40s and 50s from heart disease?
Yes, and it's a quite interesting study I have going on in my family, because my mom lived to be 90. She lived to be 90. Her mom died at 56. Her dad died at 48. Both heart disease, diabetes. She had 3 brothers that also died of heart disease, diabetes, in their 60s. One may have made it into early 70s. And then now we're at the next generation where people my age, my cousins, so late 50s to 60s, that aren't plant-based. I have one cousin that's in her 40s. I don't know where she is exactly. That's plant-based because of, I got her to get plant-based. But the rest of them actually have vascular disease or diabetes. So that family history has now gone into the 3rd generation. So it's not a fluke what's going on as far as how people eat and what happens to them as far as my family goes.
Yeah. 2013, 2014, you start embracing this. Your mother says you're going to fall on your face. You have, it sounds like, pretty phenomenal success, kind of reversing a lot of these diseases, getting your patients off meds. And so as a cardiologist, but I think even more importantly, as a physician that, has taken this oath to try and, help people, how gratifying was this type of medicine?
Oh, it was just so exciting. I couldn't get enough of it. So we went from 1 class to 2 classes to 3 classes. So I would do back to back, like Thursday nights, a 1-hour class, because we only had so much room. And then we went to a 3rd class, and we actually moved off site to a chamber of conference room area, place where I had a bigger facility to have the classes. And the only negative feedback that I got, and people were just, and these weren't people that wanted it. These weren't people that came to me like, how can I get off my medicines? These were people that I brought into the class kicking and screaming a little
Yeah.
bit. Would you want a heart cath, or do you want to try this? Or maybe there's nothing left. Do you want to try this? That happened in some circumstances. So these people they knew nothing before they started the classes. But the only problem was when the 6 weeks was over, they kind of fall off. They didn't have the support. And that's when we decided to change the practice so that we continue the classes for everybody. And so that's how the practice revolved. And at that point, because, and I'm sure you've experienced it, if I saw 13, 14 patients in a day and I tried to give that 45-minute speech or it condensed down into 30 minutes of why you should be plant-based, I was hoarse and exhausted at the end of the day. Because you'd have the spouse sitting in the chair because I don't want to change the cooking and I didn't come here for this and I just want, So we decided to change the practice so we could get people that actually wanted to. And that helps out a lot, as far as, continued success, to get people that have some idea that they like to do this.
Mm-hmm. So you have these classes. It sounds like they're just continuing this as a means of support. And are these classes full? Is it online? Is it only in person? Is there a waiting list? How's all that working?
We had 3 classes, and when we finally moved out, we'd have 20 people in each class, and they would, we'd cycle through a 6-week block, and then I would do a different lecture. So I had it evolved into a beginner, intermediate, and advanced. So the people that had stayed through, like, okay, I'm going to do another one, I kept up in the game as far as the lectures go, more different material. The first one is, the basics of why and how, and then we would go into different diseases. Then I started to do a literature review. So it was, an entertainment of how do I keep these people interested and motivated to do this over time. And so we're all in person until COVID hit. And then when COVID came around, all of a sudden, we became online, and that became, and so until we got through COVID, and then we gradually started the in-house classes back to some degree, and then now we do both.
Nice. So it's a little hybrid model.
Yes.
Very good.
We all learned from COVID.
Yeah. I just like to take maybe 5-10 minutes and talk about not the paradigm that you're running there at your clinic, but the current paradigm within the practice of medicine. And you, on your website, you talk about a couple things that are going on there. And I'd like to just, for me to toss it out to you, and then for you to talk about it for a second. So the first thing you say is that the current paradigm, it's hurried. Like, explain what you mean by it's hurried. They only have a certain amount of time to see each patient, and it's just not conducive to kind of solving the issue.
Unfortunately, in medicine today, for a physician to make a living, it involves tests, and it involves seeing quite a number of patients. So it is not unusual for a practice to run 40 people through a clinic in a day. Clicking EMRs, ordering tests, that is survival mode. So if you have 5-10 minutes with a physician, if you're lucky, most of the time it's an allied health professional that you have 5 or 10 minutes with. What's your problem? Here's your prescription. Here's the tests we'll order. The only comfort that people get is we've ordered these tests. I get all the time. We're following your carotid stenosis. We're following your kidney failure. We're following your diabetes, into the grave essentially, but nevertheless, we're following it. There's no time for education. It is, if anything, it's eat healthy. And again, as we know, but I don't like that excuse that no physicians aren't given nutrition education. I don't think that counts. I know a lot of things that I didn't know when I walked out of medical school. I learned on my own. So everybody has the opportunity to explore nutrition. It's just not something that keeps the practice doors open. And unfortunately, that's why we changed the whole way we do the practice, because you can't, again, I can't say what I need to say. I can't educate how I need to educate and see 45 patients. There's no way. And I never did do that. I was never a physician. In a bad day, we may have run 13, 15 patients, in an office setting. And even that would be a very high number. But you can't educate people that way. And you can't answer their questions, especially if somebody comes in completely, a novice to, you mean there's some way that I could reverse my disease without a stent? So you can't start that conversation with 5 or 10 minutes. And that's really the basis that the whole thing is. And then, let's face it, if a doctor's not convinced that it works,
right,
they're not going to do it. When I go to the hospital, because when we first started the practice, and I still go to the hospital if need be. The only time I really have to go to the hospital now is if somebody falls and breaks a leg or has pneumonia, something, but it's not a heart issue. I don't have any heart attacks happening. But if I go and I happen to walk through the doctor's lounge on the way out, first it's, do you still run? How are your knees? And I couldn't eat that way. Those are the sentences that I get while they're loading their plate with cheesy eggs and bacon and sausage, So, the physicians aren't going to really tell you what to do. You should eat plant-based, but I'm not, I'm not going to. Nobody wants to hear anything bad about their bad habits.
Well, yeah. And it is amazing how I think that the American psyche is such, and the way that we have been kind of educated, that the thought of food being able to reverse something as radical and as intense as heart disease, you got to be kidding me. You mean I can reverse it with fruits and vegetables and beans and whole grains? That sounds like a pipe dream, but they just don't know, right?
Yes, and it is, and once we got going, it's like this is the easiest disease to fix.
Isn't that something?
This is the easiest disease to fix between cardiovascular and diabetes. Taking people from 100 units of insulin down to nothing, that had been on insulin for all these years. And it's like, this is the easiest thing to fix in the world.
Now, are you talking about heart disease now, or are you talking about diabetes?
Both.
Both. Right.
Both. They're the two easy ones. I tell people, it's like, these are the easy ones to fix. Yeah. Cancer, when you have cancer, and we do see, because now I see a variety of people come into the office, so when that has progressed, it certainly can get better and certainly has helped, but probably a little bit more strict, maybe tougher, but it doesn't take much to take angina off the table. You could, the first guy that I had that I saw it in the face, he was in my practice for years, and finally his stents are clogged, his bypass grafts are clogged, and it's like, he's in a little bit of heart failure. He could walk 3 miles. Now he can only walk about 25 feet without getting angina. And it's like, there's one last thing to try here. I said, if you would be willing. And his daughter was with him. And it's like, we'll try this. And they came to class. His daughter lost 30, 40 pounds. He lost weight. His chest pain was gone in weeks. And he was back to walking. And he became a little poster boy. We gave everybody T-shirts, Jami Dulaney, plant-based, all this kind of stuff. He would wear it to Sam's Club and, find people and make them put their stuff back. He was my little disciple going out. It's like, you're Dr. Dulaney's practice. You can't eat that,
Explain to the listener right now. So this gentleman who's an absolute train wreck as far as his arteries are concerned, it sounds like, and he's got the angina. You get him to go basically whole food plant-based, and you say within weeks the angina kind of disappears, goes away. What is going on at a physiological level that allows that angina, the chest pain, to go away?
We opened up collaterals. So with the nitric oxide producing greens, so 6, 7 cups of greens, that's our main focus. Of course, taking the oils out, taking the animal products out, but those greens allow his little tiny collateral blood vessels, and we describe them as the side streets instead of major thoroughfares. So all your little side streets open up, and you can get where you need to go. And, so his big vessels, probably we didn't do another catheterization, but they didn't open back up. But all those little collateral ones did, and he could do what he wanted to. And we've seen it over and over again, and we've done some stress. Early on, I did some stress tests, nuclear stress tests, something, Dean Ornish's studies looking at the perfusion of blood to the heart before and after. And we've shown reversal that way. It doesn't mean, it doesn't mean that the big arteries open, but the blood flow to the heart was such that it looked completely normal.
Is that through like the PET rubidium scans?
Back in the day, more just a nuclear stress test. So just so not as fancy as PET, but the traditional treadmill nuclear injection, a systemibi, so same imaging, but different machine.
Yeah. I've seen a lot of before and afters that my father has shown me of some of his patients. And in literally 2 to 3 weeks, it's incredible the profusion of blood that gets to the heart and how much just more extensive it is. It's phenomenal.
And, we have people that their heart function was not very good, and, they're doing what they want to do. And, it's just amazing. And,
Yeah.
and quick.
Now, there's a lot of different types of cardiologists. What kind of cardiologist are you?
I was a traditional cardiologist that I did heart catheterizations, pacemakers, stress tests, echocardiography, transesophageal echo. So I call myself a generalist. I did not put stents in. Mm-hmm. I did the cath. I would refer for the stents, but I would do the diagnostic cath to see what the blockages look like, what the bypass grafts look like.
Mm-hmm. If you were to grab 100 people just off the street in any major city, and just to see if they have blockage, what percent do you think, and these are people that are 50 to 75 years old, what percent do you think would have blockage?
50 to 60 years of age, probably 45 to 50% of them. You get over 60, you're going 50 to 60% of them. It's quite high. As far as, and that's kind of where I think the cross, we are trying to detect vascular disease early and earlier by imaging, calcium scores and CT angios, now that they're not invasive.
Yeah.
When I first started in, 1999, we would do a stress test. And if the stress test was abnormal, we would go directly to an invasive procedure, the heart catheterization, where we would access the patient's artery and take the catheters up to the heart and inject dye. And that had carried a risk. It carried 1% stroke, heart attack, death risk just doing that procedure. So you were a little bit more conservative because the procedure itself could cause a problem. So you thought about it a good bit. Now we have CT angio, where you just jump in a scanner, get some dye in, and there's mathematical algorithms, and they can say, well, you've got a flow rate change, and maybe you have a 60 to 70% lesion. Now we're going to go put a stent in directly. But again, we're going to go back to that. You asked me the general population walking around without any symptoms.
Yeah.
They're there. So the question is, what causes them to progress to a heart attack? And that is typically an unstable plaque or a soft plaque, which is not picked up by a calcium score. That's a healing plaque. So, again, we're taking people to procedures where they have no symptoms. Now,
what's interesting is you just said that's a healing plaque, and I think you were referring to the the calcification.
Yes.
Right. Right. And so it's the soft juvenile plaques that are the major culprits for the heart attacks. True?
True. And it could be as little as 20%.
Mm-hmm.
So a 20% plaque can rupture and a clot can form in that 2.5 millimeter artery and cause a major heart attack.
Yeah. And do you ever have a rupture and then a blood clot that doesn't cause a heart attack? And if it What does it cause then if it doesn't
Yes,
cause a heart attack?
all the time. So if, you can have that plaque rupture, and if you think about it being a straw, and the plaque ruptures and the blood clot completely fills the lumen or diameter of that straw, that would be a major heart attack. Sometimes it just ruptures a little bit and the body kind of clots off, but doesn't clot completely, and it seals down. So maybe the plaque would go from 20% to maybe 35%. No symptoms. You don't even feel it. Maybe it progressed to 50 or 60%. When it gets over, we know about 75, 80%, then people start to have symptoms when they walk or they do heavy exertion. So the scary ones, the ones we'd all like to prevent, are the ones that go from 20 to 100% and people have a heart attack and die. That's the one everybody's trying to prevent early on, because people don't. But the reality of it is most people do tend to have a little bit of progression of symptoms as opposed to just right then and there, it happens.
Right. What, in your opinion, are the biggest risk factors for cardiovascular disease?
Diabetes, number one.
And a lot of Americans are getting diabetes.
Yes, metabolic, we might as well just make it big and bigger, metabolic syndrome. So, if your hemoglobin A1C is abnormal and your triglycerides are you're overweight, you carry the same risk as somebody with full onset diabetes. So when people say, my doctor says I just have borderline diabetes, doesn't matter. The clock's, that's a big risk factor for progression of vascular disease. And then, I'll go with high lipids, being overweight, high blood pressure, smoking, obviously, add them on. But, to me, diabetes is because there's so many things associated with diabetes. Your insulin is high, you're producing insulin-like growth factors, you're producing more inflammatory factors, you're producing more clotting factors. And that sets the stage, for everything to start to progress. I don't believe one thing causes anything. There's got to be, people just don't have one thing and then something bad happens. There's a bunch of little factors that go together for them.
Yeah, a constellation of things.
Yes, it's not just my family history.
Yeah. And what foods, in your opinion, are the most, I'm trying to think of the best word here, dangerous when it comes to promoting atherosclerosis?
I'd be careful, because if my members are listening, they'll say, but you said.
I know.
Have you ever heard that, it's like which one thing can I cheat on?
Exactly.
So I mean, obviously, animal protein, that drives inflammation. I would have to say, not animal protein. Let's put it this way: animals. So eating beef, pork, chicken. It causes so much inflammation in the stuff. But again, it's not in a vacuum. It's cooked in oils. There's so many people just don't do one thing wrong. Certainly dairy, to me, if somebody says, what's my cancer risk? The dairy seems to be, to me, scares me more than anything. But it doesn't happen in a vacuum. People that, I always say, if you say you don't eat, or I'm not worried about eggs, because people say, well, I only eat one egg a week, or one egg a day, or one egg a week. And it's like, but if you're not looking for it, the eggs are in the pastry that you ate, the eggs are in the bar you ate, the eggs are in the product, the coating, the whatever you ate. So the reality, and you're not looking for them. If you go to Starbucks and you buy the pumpkin bread, you're not looking for the eggs.
Yeah.
That's
a really good point. Yeah.
So if you don't I tell people, if you don't put a fence around it, you're not aware. Like, I don't have to go to the bakery in Publix because I know everything there has eggs and oil in it. So there's no reason for me to walk that way.
If you don't put a fence around it, you are not aware. Oh, I've never heard that before. That's so good. So many great sound bites. You are great. First, how do you refer to yourself when you're sitting next to somebody on an airplane and they're like, "Oh, hi, I see you ordered the vegan meal. Why is that? How do you eat, and how long you been doing it?"
I'm a plant-based cardiologist. Been doing this for a long time. It's working. I have a strong
Mhm.
family history of heart disease. This is how I live. This is just
Mm. And so you use the term plant-based as opposed to whole food plant-based or vegan, but
you know um, early on, I will tell you that I would just go vegan, but that alienated so many people.
mm,
That it's like, no, I want to be a healthy plant-based person. Um, and when I say plant-based, it's like, well, I don't eat animal products. And they'll say, of course, then you go down the road, nothing. It's like, no, none of them. But yeah, yes, I get the plant-based, whole foods, plant-based. Yes, I don't eat processed food. If somebody wants to know more, I certainly will give them the spiel.
right.
But I usually don't, on an airplane engage. It's as far as, do what you want. This is, if somebody asks, I'm willing to tell you. I'll let you know every secret I have. But
Yeah.
um, and it works for me, and it works for my family. I'll say all my family eats this way. So I'm not doing anything. I don't ask anybody to do anything that I don't do.
Yeah. If I was sitting next to you on an airplane, what if it was, let's say, a 3-hour flight? You probably came prepared. What would I see you eating?
Well, it's 3-hour flight. If you saw anything anyway, I might bring some fruit, or I might have actually even a bowl of something that I made a salad, or bring out. I make sourdough bread, so there's a chance that I would pull
Mm.
out some sourdough bread or a sourdough bagel that I had made. That would be what we would do. We're pretty good about locating. When we get off an airplane, we're typically going someplace to run or do something, so we're kind of hungry, and so we'll have it mapped out where there's some place that we can find good food.
Yeah.
And we typically will, head to some Thai restaurant or some restaurant that has, some sort of, make your bowl of sorts that you have some control over. Um, but that's usually how we roll for the most part. You might see me eat some oatmeal in the airport before I take off, but
Yeah.
nobody ever starved to death on a 3-hour flight.
No, no. Did you find when you made the transition, um, did you find it to be difficult, or were you just all in and nothing was going to get in your way?
Yes, I was just when I say I was all in, I'm plant-based. I'm not going to eat any more animal products. That was, game over. I did it. It wasn't like I'm going to phase out things. I just became plant-based. Now, I did not give up oils right away. So I wasn't,
Hmm.
I wasn't without doing some, oils. And uh, another great learning experience. My mother had reflux and stomach issues, and my mom's was Italian, and did the oils and things on salad. Not a tremendous amount, but had a terrible stomach. And when I turned 40, I had the same type of issues. And it wasn't until I got rid of the oils that I got rid of the GI issues.
Yeah.
And so that became, so when somebody comes to my office and say, oh, I can't eat hot peppers, or I can't eat this because I have indigestion, it's like, no, you don't. You have too much oil in your diet. And, and it's been 100% accurate. You get the oil of people's diet, their indigestion goes away. It's
Isn't
just,
it?
of
And,
course,
and and why do you think that is? What do you think is going on there?
it's just an inflammatory, because sometimes people eat oils and they have joint issues, but I believe it's an inflammatory issue that some people get GI issues and the acidity associated with the oil. And just, I produce a lot of acid probably, and the inflammation that the oil causes in my GI tract will just light me up. Some people it lights their joints up. I never had joint problems, but boy, I tell you, you get a piece of fried zucchini near me, and I'm in trouble. Or even nuts. I don't even eat a lot of nuts because of it.
Mm.
And I can, if I went, sometimes you'll go someplace or you'll be exposed to something and you backtrack and there it is. So I'm very careful because it was bad, and that was one of the most things that caused me more discomfort than anything that I've ever had experienced, as far as that, that reflux symptom. And so I don't want the meds, because we know those meds carry with them the risk of everything else. You must, the proton pump inhibitors increase your risk of heart attack, osteoporosis, malabsorption of different vitamins and minerals. So I don't want any part of those. And your body gets very addicted to them. It's not, you can take them once in a while on and off. It's not an easy thing to get rid of.
I'm going to go back to oil for just a second, because there's so much, it seems, I'm going to call it misinformation and just kind of debate going on around the benefits of some of these oils, specifically, extra virgin olive oil. Do you keep up with the literature, or do you do you ever go, oh, maybe there is something to oil, or are you just like, hey, I'm not gonna go there. I'm not buying it.
I don't see it as something we need. I don't think that oil is going to prevent any bad thing from happening. If you substituted extra virgin olive oil and hydrogenated oil, could you, would it be better? It's better than what? But, is smoking a filtered cigarette versus, it's the same thing to me. I haven't seen the benefits. I think that there's not much in the way of pure oils. So you're getting a lot of combinations, and the omega-6s tend to go to make inflammatory compounds. They make clotting compounds, and I don't need those things. That's most of the people get way too many omega-6s. Again, you're not looking for them. They show up everywhere. Everything you pick up has 3 or 4 different oils stacked in them or made with. If you go into the freezer section and you start to try to find some, vegan meal or so, different oils. They have to use them to kind of mask flavor, perhaps shelf life. But you get so many omega-6s that you outnumber the omega-3s, and I think that's where we get into the problem. So I tell people, everybody needs to cut down omega-6s because we get plenty. Yes, they're essential fatty acid, but we're all getting plenty of those. And when you look at the ratio of 3 to the 3 is where we're trying to get, but you can't eat enough chia seeds to outnumber all the omega-6s that people are exposed to.
Yeah. No, I couldn't agree with everything you said more. And, with a American population that is somewhere in the neighborhood of 2/3 either overweight or obese, the last thing we need is unnecessary empty calories, which I think you and I both would agree is what oil is. So.
Well, I do. In the cooking demos, people say about a tablespoon of oil is 140 calories. You got 9 calories per gram of fat. And, I'll show people a real tablespoon measuring, not the one that, that you just keep pouring and the girls are inside. But it's like nobody cooks with just a tablespoon of oil. It's not just an oil. It's one of these things. Watch any cooking show. It's like, it's horror to watch people use oil when they're doing a cooking demonstration on TV. And, it's cups. It's not tablespoons. It's cups.
It's quarts, for Pete's sake.
Yes, and so are they using the fine virgin olive oil that the guy up in the mountains in Italy is using and measuring just so much because it's so expensive? Of course not. And it's like they don't have that many olives to make this much oil.
Yeah. I would love to talk a little bit now about your running.
Good.
Because it sounds like you really love running, and I'd love to know from you, what gifts have running given you?
Mindfulness. Mindfulness, I would say, and take the edge off, so to speak. But it's been a great outlet. But a great way to stay fit with a shorter period of time. And it's just been a challenge. With a marathon, I started out with marathons, and, I always laughed. There was always a story when I would come back to work on Monday. I did something stupid, and I learned from it. But nothing ever went perfect in 26 points. There was probably 4 good marathons, but otherwise something stupid, whether, whatever I would do, so it made for a great story. And it also made for, if I can do it, you can do it. Because I was a golfer and I, decided to go from running 3 miles to a marathon. So if I can do that at, age 40 when I started, then anybody could. And then it just, and then it became the first one. My mother said, again, my mother, you would think she wasn't encouraging by her these quotes, but she would say, "Did you get that out of your system?" And it's like, no, I said, I think I can go a little faster, but it became a way to travel. Because we would base, and instead of golfing trips, I started basing my family vacations around going someplace to run, whether it was in Europe or wherever we'd run. And so it's a great place to see a city, great place to see an area by running. And then it became the positivity of people. Where can you find people line up around a street, cheering for complete strangers who are running, way back in the pack? They're just hoping that they live to the finish and they love to see the struggle, and it became such a, I always said, if I could take the scene at the marathon and all the people cheering and happy and positive thoughts and affirmations and put that into my practice, then everybody would run. If they could just see what it would do. Mm-hmm. I have to share one funny. Well, I had a little lady that was, I saw every couple of weeks early on before the practice changed. She had heart failure, and she came in, and I had my Rome Marathon picture up on the wall, and she said, "So, were you in the Olympics?" And I said, "No." And I said, "I just ran the Rome Marathon." And she looked, and she said, "Did you win?" It's like, "No." And she said, "Well, what place did you come in?" And it's like, 10,000 or something like that. And she was so disappointed. She's like, maybe if you practice. And it's like, no, I'm taking care of you. So I only can practice so much. So, we'll just go with what it is.
Yeah. I don't think she quite got it.
No, and people ask, that was the kind of comments I got early on. It's like, if you're going to lose, why do you go anyway?
Yeah. Well, you started, or maybe you started, I don't know, 10 years ago. I don't know the timeline, but you started gravitating towards some of the ultra distance running events, these 50 and 100 milers. Why and what kind of depth of meaning did you find in doing those longer events that, for me personally, I have no interest in those, but I know enough people that do, that there must be something that you get out of them that is magical.
It is. Again, the longer you go, the more things happen, the more you have to troubleshoot. But you go to the beauty. So most of the ultra marathons are in, trail marathons. So you're out in the woods. They're smaller. The community, you get to know more people. You can run the New York Marathon with, people all the way around you and you never talk to anybody. But in an ultra marathon, it lasts long enough. People talk. And, the people that are supporting other people, it just becomes more of a family type situation, or, you get to know people. There's something in pushing yourself to the point where you didn't think you could go. Mm-hmm. And it strips everything down from everybody, and so you're just there raw. And, I'm not quite certain how to explain it, but it gets to a point where you're right there in the moment. When I'm trying to manage nutrition and mileage and hydration and where I'm going, I'm not thinking about anything else. You don't think about anything else except right then and there. And it takes you to a mindfulness that not many other things allow you to do. You can do most anything and your mind can wander, but when you don't want to get lost in the woods and or get sick or whatever,
No, there is something beautiful about being 100% present in something. That's one of the things I love about mountain biking, is I find that I have to focus so much on the trail and everything that I get back from like an hour and a half, 2-hour mountain bike ride, and I feel absolutely cleansed, certain, rebirth of sorts. Tell me about your nutrition. So if you're doing have you done Leadville?
I have done the 50-mile Leadville, and I am signed up for the 50-mile Silver Rush this year, and I'm signed up for the 100-mile this year.
Oh my
Yes.
goodness gracious. So tell me this. You've been doing these long enough. You must, for the most part, I would imagine, have your nutrition kind of dialed in. And I would imagine that's one of the greatest things to kind of figure out. Give me an idea. How many grams of carbohydrates are you trying to take in every hour over, let's say, a 12 to 24 hour period?
I'm trying to do 80 grams.
80 grams. And how are you doing that? Is it liquid or is it something
Combo.
else?
Combo.
Oh,
Depending, the more elevation or heat would be more liquid. And then, the some solid food. As you know, the longer you go, the more difficult it gets to look at some of those gels.
yeah.
And you can get even the sports drink I've got, the one I use is I'm pretty tolerant of it, so I haven't gotten sick of it. I remember the old days of Gatorade when I can't even look at a bottle of Gatorade; it
Mhm.
makes me ill. Just but I use a gnarly of powdered stuff that I dump in water, and so I can measure. I have a pretty good count of how many grams of carbohydrates that I want to get in an hour. I tell people, I'm very honest with people. It is not a Dr. Esselstyn improved carbohydrate regimen during those things. It's how can you get glucose in any
Yeah.
way you can. Sprouts gummy worms that have natural color flavoring are not off the table, but anything. But there's often bananas, oranges, that kind of thing, sometimes watermelon. But, I am not, that is one place, it's the only place where I will do peanut butter.
Hmm.
I will do peanut butter and jelly sandwich on an ultra, just because it's there and there's some sort of solid food. Potatoes are great, white potatoes if they have those. Um, but it's what you can carry and what you can get in fairly quick. And the reality of it is, the liquids tend to do better than anything.
Yeah. You look really sturdy. You look strong. You don't look, to me, like when I see you, you don't look emaciated as I would think some ultra distance runners would look. Are you doing much strength training? What are you doing to preserve your muscle mass?
I do strength training. I do strength training twice a week. My son-in-law is actually a collegiate strength coach, so he's my
Oh, that's nice.
yeah. So I get my programs for free, and call him up and he troubleshoots with me to get me back on track. But yeah, that has been the big changer with going to running the ultra distances to have the strength training program alongside. Before I did ultras, I did Ironman for a while, and the
Hmm.
Ironman keeps you pretty well rounded because you're swimming and biking and running as you've done, So that kept me. I was probably less prone to injury, and I didn't do much strength training when I did all three. But going just to running, you tend to get a little bit unbalanced at times. So the strength training is important, and that's the other thing that I try to promote. Actually, I don't think. I think that vegan gets a bad term when you talk about somebody, really skinny and emaciated and, they don't ever go outside and da 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 da. I think a healthy lifestyle involves exercise as well as, plant-based nutrition. And, more and more literature comes out that you have to be able to maintain muscle mass to be able to utilize calories. If you can't if you can't take food and turn them into energy because you don't have the muscle to do so, then disease will progress regardless of what you're taking in.
How have you fared as far as remaining injury free over the years?
I have little niggles. When I did my first 100 miler, it was complicated by 4 miles of ankle deep mud and with the posterior tibial tendinopathy that lasted quite a bit from squishing around for all those miles. Because you repeated it 6 times, so every time you did a 16,
Oh,
you got 4 miles of Kentucky Derby type mud. I've had some back issues over the years, sciatica and things like that. Mainly muscle imbalances, not discs for the most part, but just um, muscle imbalances, hips. So maintaining hamstrings to match my quads and so forth, glute strength and
Mhm.
things like that. Again, not being a natural athlete, being a golfer. It was, so some of those muscle systems have had to come along over the years, and then trail running also was much different than road running in that those little tiny tendons and muscles get much more of a workout on uneven surfaces that you would, that it's that way, but you just don't know how bad it is until
Mhm.
you go into it. So I had the cardiovascular fitness to go longer, but my little muscles and the little tendons, would scream some. So that's been the focus.
In your opinion, if you're going to go out for a run, does it have to be at least a certain amount of mileage in order for it to count? What is your what is your philosophy on that?
Don't put my shoes on for less than three. Um, yeah, I mean, I've as I've gotten older, there's there may be I still, 3 miles is probably the bare
Mhm.
minimum that I would go out. I might take a walk if I'm like, it's hard to take what we call a rest day, because again, the rest of my job is not that physical. So when I say, it's a rest day, it may be something easier.
Mhm.
But just to, I don't really ascribe to do nothing days for the most part, unless I am injured or sick or something like that. But for the most part, I'll do something.
Yeah.
Um, uh,
Have you? I know you've had your own podcast, the Jami Dulaney Plant-Based Wellness Podcast, for years, over 500 episodes. Congratulations on that. That's an amazing feat. Have you ever had Harvey Lewis on your podcast?
yes, I have. He was actually one of my first um, interviews.
Wow.
No, well, no, not Harvey. No, I'm sorry. Harvey, I have had on. I had him on a couple years ago, but I had Harvey. But there was another guy I thought you were going to talk about.
Yeah.
But yeah, Harvey was on the podcast, and he's just, I mean, he's phenomenal. He runs every day to school, runs every day to school and back. I mean, he's just kind of an unbreakable kind of guy, and he can take in, mounds of food and go run hard. He is a
Yeah.
well-oiled machine.
For people that don't know who Harvey is, he's been on the Plant Strong podcast as well, but he does all these ultra distance races, these backyard races where you basically do like a 4 mile loop and you go until there's one person standing. And he's gone for, I think, well, I want to say like 400 miles.
Yeah, like I
Uh,
think it could be 460 or something.
it,
It's incredible distance. Yeah.
it's something ridiculous. And I can't fathom how, after doing what he's been doing for years and years and years, he somehow hasn't crumbled, but he just seems to
He
have,
does he
yeah,
does strength training. He does, some rehab, massage. He takes, it's just not all running.
yeah,
And I think he's really good at not pushing the pace all the time. So I think he's, pretty balanced in it,
hmm,
how he
yeah,
goes about things. And he can take in a tremendous amount of calories. I mean, you do have to fuel.
yeah,
And I think he's very good with his nutrition.
yeah. And he's plant based.
Yeah, he's
So
plant based. I mean, that's where it's at. Yeah, I mean, he's plant based, and part about and that's a lot of his running is to kind of promote that.
yeah.
There are a lot of, I would say, a fair number of plant based ultra runners.
Hmm. Do you offer any kind of telehealth medicine with your practice?
Yes, we have 3 levels of online
Uh-huh.
education or medicine. There is one that I will do telehealth, a full membership, and then my daughter is our registered dietitian, and so when people get a monthly call from her as well. So we have a website. People can have access just to the website. They can have access just to Addie, the dietitian. They can have a coaching session with both of us. And then they can have a full membership. So we have people all over the country that, are looking for somebody to listen to them and looking for somebody that's not going to have them, do, invasive procedures, or somebody just to go over with what they have and help them make a decision. Because at the end of the day, it's my job to educate people to the best of my ability. And then I tell them, you make the decision and I'll support you in whatever you do. But I'm going to give you my honest opinion about what I think, are the options and what I think could be the best thing. But, I don't turn anybody away. It's like, well, I can't come to you because I'm not 100% plant-based. And it's like, no, we meet people where they are. I wasn't 100% plant-based. We've all had to evolve. And, so, but, again, it comes down to having somebody to talk to them.
Yeah.
Take time and listen.
And your daughter Addie, she's the one that has dibs on the strength training coach, right?
Yeah, she has dibs on the strength training coach, and she does some programming too, as far as she exercise phys background. So we get basic programs. We try to incorporate with our members to do strength training. And we have a wellness challenge every month with our members. So we have, 30 days of do this today or add this on, do this, walking challenges, maybe running challenges, maybe squat challenge. So we try to incorporate all of that into the practice members to try to get people to have more of a community so that they can join in. And I think that's one of the big things. People think that they're the only one that struggles. And they're not. Everybody struggles, and I think you have to realize that everybody struggles, and it's better to learn from each other, and we just go with what we got and work our way out.
Yeah. What is the name of your medical practice?
Jami Dulaney, MD.
Got it. Wonderful. And what's the best way for people if they want to know more about your practice?
DrDulaney.com, DoctorDulaney.com. And then you can email Jamie at Dr. Dulaney as well.
Yeah. And you're offering some kind of membership-based medicine, if you will. Is that correct?
Yeah, we do a member. So what would typically happen if you call me up and say, hey, I'm having some angina, I want to explore this plant-based thing. And so I talk to people for free. We do a little, this is what you want. This is what we have to offer. And then we try to get people to give us, if they want to be a full member, at least a 6-month commitment. Because we get their medical records, we go through everything, we call them, they get my phone number, they can call me whenever they want. They can, and so we to really find out whether you're going to be able to do this plant-based thing takes a minute. And so we think 6 months is a good try. Is this for you? It either is, and you fly and you stay on. If you don't, fine, go on. We have people that come and go. They say, oh, I got it down, but they didn't. And they come back, and that's okay too, But we like to try to get people to commit a little bit to at least our full membership.
Yeah. Well, that sounds like a really nice model that you have there. What's the next on the schedule for the next race?
Silver Rush 50 in July is the next official race in Colorado.
How are you going to fare at that altitude from Florida?
Well, people say the humidity is a little bit like altitude, but not really. We go to do some trail racing, trails locally, but I will go out in June and do a kind of practice run, spend a weekend running the trails out there, and then I just crank the old treadmill up to 15% and, go on it.
Yeah.
Pull a tire. We have 100 degrees and high humidity here today, so, it's...
Pull a tire. I love pulling a tire. God, my mom loves pulling tires.
I know. I see her pulling a tire. Yeah.
Pull a tire.
Pull a tire, lifting heavy things, and then it comes down to, yard, just being active and hoping for the best. I'm not, unfortunately, like my patient asked, I'm not going there to win. I'm going there to finish.
Yeah.
And have a good time and enjoy. I think it's a beautiful, beautiful scenery out there. We just, fell in love with it the first time we went out to do the marathon there. And, who knew that, when they signed up for the marathon, it's like, it's just 13 miles out, 13 miles back. How bad could it be? Except for that you go from 10,000 to 13, I think 13.3 or something like that for the marathon. And
Yeah.
it felt like we were doing a 5K, because your heart rate there as soon as you get out of the car, it's like, whoa. So it's like, oh, this is going to be a lot slower than
Yeah. Well, I wish you all the best at that race. And then when would you be doing the Leadville 100?
So the 50 milers in July and the hundreds in August. So
Oh, so
about,
the 50 is a warm up to the 100.
there's a 4 week turnaround. Yeah, I'm a little scared / terrified. Yes, terrified is really the word.
Well, you know what? It's nice to feel alive and terrified every once in a while,
It
especially when
is.
it's this kind of a goal that you've put in front of yourself. I congratulate you. Way to be.
Thank you. I'll be 63 when I toe the line for the Leadville 100. And if you look in the results column, there's not a lot of those in the women results. But I'm writing my own story. It started late, so I'm hoping I got a long time before I peak. So
Wow. So if you had your druthers, how long would you continue to do these ultra distance runs?
I have such a good time. I can't see stopping as long as I can. Will I always be able to, try to train for 100? I don't know. But it's just nice to be out there. I actually have people that are in their 70s and 80s that I've ran marathons with that are in the practice. That trained for their first marathon. So, the idea is just keep going. I have an 89-year-old member of the practice that can still pull off, she 89? Yeah, she's 89. She can still pull off a 16.5-minute 5K.
16 and a half?
Average pace, 16.5-minute miles for
Okay.
miles. Yeah, so, yeah.
Wow. That's something.
It is, so they're setting the bar for me, so we'll just keep pushing it.
Yeah. Well, this has been such an uplifting conversation. I love your spirit, your enthusiasm, all the great work you're doing with your medical practice. Being terrified every once in a while is good for all of us. And I can't wait to see the results of the 50 and the 100.
Thank you very much. Last thing I'll say is when I was getting ready to do I think may have been my first Ironman, and I had your sister on the podcast. And I said, give me a pointer for swimming. And she said, stay along.
Stay along. Yeah.
I did, and it worked.
I would have told you just like get out to the left or the right and just don't be fighting with other human bodies in the water. It's just unnecessary energy.
Florida Ironman was basically being in a salmon pool. It was just a washing machine. Yeah.
Yeah. We like to say it's elbows and assholes everywhere. Yeah, for sure. Well, listen, it's been wonderful. On the way out, can you give me a virtual Plant Strong fist bump?
Absolutely. There you
Boom. Go. All right, Jami, go get them.
Thank you so much for having me on.
Absolutely. To learn more about Dr. Dulaney's practice and her classes, you can visit her website at Dr. Dulaney, and that's spelled Dr. DoctorDulaney.com. And I'll put a link in the show notes to make it super easy for you. You can also listen to her plant-based wellness podcast wherever you listen to your favorite shows. And I'll also drop a link in the show notes for that as well. Until next week, don't be afraid to challenge the status quo. Continue to empower yourself with knowledge from experts who care. And always keep it Plant Strong. The Plant Strong podcast team includes Carrie Barrett, Lori Kordowich, and Amy Mackey. If you like what you hear, do us a favor and share the show with your friends and loved ones. You can always leave a 5-star rating and review on Apple Podcasts or Spotify. And while you're there, make sure to hit that follow button so that you never miss an episode. As always, this and every episode is dedicated to my parents, Dr. Caldwell B. Esselstyn Jr. and Ann Cryle Esselstyn. Thanks so much for listening.